So the term PCOS or polycystic ovarian syndrome is so confusing to patients because they think if they have the diagnosis of PCOS, that means that they have ovarian cyst. And those are two completely different things. An ovarian cyst on an ultrasound is a little outpouching on the actual ovary itself that can cause pain, bloating, discomfort, and sometimes even bleeding irregularly. For the most part, simple ovarian cysts are pretty self-limiting and they typically resolve on their own over the course of about 6 to 8 weeks. And some people may be prone to developing ovarian cysts and may develop them pretty frequently, but that doesn't mean they have the diagnosis of PCOS or polycystic ovarian syndrome. That's a completely different disorder. PCOS is a hormonal imbalance between estrogen, testosterone, progesterone, LH, FSH. Your levels are just not in a normal range, and because of that, you have irregular periods and you're not ovulating correctly. Often you have higher levels of what we call FSH or follicle stimulating hormone, which means we're stimulating your ovary to release a follicle or to ovulate. However, you don't have high enough levels to pop out an egg. So on an ultrasound, you're going to see multiple immature follicles, which seems like these little swollen balls that are in a linear area around the peripheral of the ovary, almost following what we call a string of pearls. This is very different than a simple ovarian cyst. It often doesn't cause pain and discomfort, but you have other symptoms that are associated with PCOS. So if someone told you that you have a cyst, that does not mean that you have the diagnosis of PCOS. The more you know.